Hi, great nurses. Welcome to the Career Pathway channel. Here we guide nurses on their pathway to success. Here is your career code. In NUS 111 Applied Chemistry Module 4, we discuss electrolytes and electrolysis, including their application to nurses. Here in Module 5, we want to understand the application of your knowledge of carbon and hydrocarbon compounds to nursing practice. As usual, I want you to know that this video aims to see how you can apply the little things you are taught in class in your nursing practice, giving you a general overview on how to understand these courses. So basically, we understand that for all our videos, red circles indicate that these areas are the must know for your examination. Orange circles indicate that these areas are good for your clinicals, and the green circle asks you to skim through this video at later time. Let's begin with the specific objectives for Module 5. Specific objectives for Module 5 are as follows. 1. We'll discuss carbons. 2. We'll discuss the properties of some elements. 3. We'll discuss hydrocarbons, saturated hydrocarbons and unsaturated hydrocarbons. 4. We'll discuss functional group in chemistry, such as alcohol, amines, carbonyls, and carboxylic acid, and how they apply to the nursing practice. Let's begin with Objective 1. We'll discuss carbon. Carbon chemistry in nursing, from molecules to patient care. Carbon forms the skeleton of every drug, hormone, and pathogen component you handle. Today we will understand carbon's unique role in biological system and in nursing practice. Just take a look at this. Aspirin is a pain relief. Ethanol wipes is used in disinfection. IV tubes are made of PVC. What do these have in common? The answer is carbon. Basically, the nurse deals with carbon elements in their everyday nursing practice. This is a practical application. Carbon has the ability to catenate, which is the ability to combine with other elements. It is the reason why drugs such as your medications fit into body targets like keys in locks. Carbon has very high capacity to attach itself to other compounds or elements. That's why it's the major component of all medication, and it helps to attach itself to areas where the medication needs to work. Drug design. Carbon is used in drug design. Morphine, which is the complex carbon ring, binds pain receptors. There is therefore need for the nurse to monitor for respiratory depression. Carbon structure dictates side effects. Carbon is also needed in pathogen targets. Antibiotics like penicillin disrupt bacterial carbon-based cell wall. Nurse action. The nurse must assess for allergic reaction when penicillin is administered. So this is an immune response. Allergy here is an immune response to carbon structure. Carbon is also responsible for dictating side effects. These are the various importance of carbon in nursing. Some drugs have simple chain structure, while others have ring structure. This is why medications like acetaminophen, which is a chain carbon compound, and ibuprofen, which is a ring carbon structure, work differently. So you see why mechanism of drug differs, and they do not follow the same pathway in their mechanism of action. Straight chain carbon and ring chain carbon are a definition of the pathway through which medication works. What you need to know about carbon: you need to know that carbon is the backbone of life. All organic compounds, including protein, lipids, carbohydrates, and nucleic acid, are built around carbon atoms. In case you are asked in an exam, what are the application of carbon to nursing. You should know that this should be the basis of the explanation. Number two, have, have carbons have the ability to form stable bonds. Carbon can form four covalent bonds, making it highly versatile in forming complex molecules. Number three, carbon's role in metabolism. In nursing, understanding how carbon is involved in cellular respiration and the formation of ATP, which is the body's energy currency, is key for managing patients with metabolic disorders, diabetes, or those on certain medication. Number four, hydrogen bonding. Carbon compounds often interact with water, which is crucial for understanding body fluid balance, drug solubility, and intravenous therapies. So these are the basic things one must know about carbon as an element. Objective 2. Properties of elements. Properties of elements tell us why carbon is not oxygen or ion. Element properties they take drug solubility, toxicity, and equipment safety. So we'll be looking at the key property of some elements, how they are relevant to nursing, and areas where nurses need to take action with regards to these elements. First one is carbon. Carbon forms stable chains. Nursing relevance. It is the basis of organic medications such as your fentanyl. Action for nurses. Nurses must know lipid solubility because medications which are soluble in lipid can cause rapid CNS effect. When medications are soluble in lipids, they could cause rapid central nervous system effects. Example is your fentanyl. So when such medications which are lipid soluble are given, there is need for the nurse to monitor wakefulness in the patient. Number two, oxygen. Oxygen has high electronegativity relevant to nurses. Oxygen makes alcohol, which is a hand sanitizer, to become polar. Polar solvent will definitely dissolve in the blood. So basically, when hand sanitizers are applied, components that may have had access to the hand can be polarized. Okay, even blood components. Action for the nurse. Hand sanitizers must be made up of 60 to 90% ethanol for best efficacy. The next element to look at is nitrogen. Nitrogen form bases. Example, amines. Nursing relevance. Nitrogen is the major component in local anesthetics such as lidocaine. When lidocaine become charged, they will block nerve signals. This basically tells us the working principle of lidocaine. Lidocaine has a basic component which is the nitrogen, neutral nitrogen. That is why it has access into the body. Neutral nitrogen is lipid soluble, so it enters into the body. However, once it enters into the body, it becomes ionized because it will mix with water components. So water components and even blood. So what happens is that it will ionize, thereby blocking nerve signals such as your sodium signals, and this will prevent pain. This will prevent the patient from feeling pain. Action for nurses. It is relevant that the nurse check the pH of lidocaine and the pH of the skin. So it is relevant that the nurse understand the pH of the skin or the area where it is also important for the nurse to note the pH of the site of injection where lidocaine is to be given for effectiveness. If it is ionized already, it will become inactive. For instance, in abscess or wounds that have been acidified, pH of lidocaine needs to be checked because they may not be effective in such areas. Chlorine is another element. Chlorine is a reactive halogen. It is used in disinfectants. It is used as bleach. Sodium hypochlorite. Sodium hypochlorite forms bleach which denatures protein. It denatures protein in the sense that it will kill proteinous cells. So that's how disinfectant work. Action for nurse: never mix chlorine with ammonia. This is a toxic gas. Objective number 3. We want to look at hydrocarbons, and here on hydrocarbons we focus on saturated and unsaturated hydrocarbons. As we all know, hydrocarbons simply talk about hydrogen and carbon actions. It could be saturated or it could be unsaturated. Differentiate hydrocarbon types and clinical impact. The first compound we have here is an alkane. An alkane is saturated because it has single bonds. An alkene is unsaturated because it has double bonds. The same goes for your alkynes. Saturation affects drug metabolism, drug sterilization, and toxicity. What you need to understand, simple understanding of why alkanes are saturated is that they have single bond on all sides. But the alkenes, they have double bonds at some sides. So saturated hydrocarbons, example are the alkanes. In your class, you'll be taught about the general molecular formula of alkanes, CnH2n plus 2. And that will lead you to know all the families in the alkane: methane, ethane, propane, butane, pentane, hexane, and so on and so forth. So basically, you'll be taught general formulas for the alkanes and the alkyne, and how they get their members. However, for nursing practice, you have to know that the saturated hydrocarbons are the alkane. We have single bonds and they are very stable. They are usually unreactive. Example is propane in medical gas canisters. It is used as an anesthesia. It is used as an anesthesia carrier. The next are the unsaturated. The unsaturated hydrocarbons include the alkenes and the alkynes, which is double bond and triple bond respectively. They are very reactive. Example is your ethylene oxide. Ethylene oxide is used in sterilize heat sensitive equipment. Nurse action: the nurse must ensure aeration post sterilization, must ensure to expose the sterilized equipment to air. This will prevent the formation of carcinogenic residues. Objective 4. We want to discuss functional groups. Functional groups such as alcohol, amines, carbonyls, and carboxylic acids. What is a functional group? A functional group of any compound is an ion, bond, or radical which determine the chemical property of that compound. Functional groups determine drug solubility, excretion, and side effects. So if you understand this very well, if you are asked about the side effect of a drug, you will not be confused. You just want to know what the drug is made of. So basically, the first functional group to look at is alcohols. Alcohols are compounds that contain the hydroxyl group, which is the OH group. The hydroxyl is the functional group. Even on looking on this, we can see hydrogen, we can see oxygen. It means this solubility is one of the properties because it means they are polar and they can dissolve in solvents. Nursing applications. Alcohols are used in antiseptics like rubbing alcohol, and In synthesis of certain medication, it is also essential for the nurse to understand the effect of alcohol consumption on liver function and this interaction with various medication, so they can counsel patients who are alcohol consumers on how their livers are being affected and how medications may not be able to carry out its therapeutic effects. Functional group number 2 we discuss are the amines. An amine is a compound that contains an amine group. An amine group is an NH2. This is the functional group of an amine, NH2. Nursing application. Amines are important in neurotransmission. Example, serotonin, dopamine, they are all made of amines. And in drugs like local anesthetics, such as lidocaine, which contain nitrogen. Understanding their role helps in treatment of psychiatric disorders and in pain management. So we see that when we study amines, we study serotonin, dopamine, which are neurotransmitters and affect brain function. And we also discuss anesthesia, which is management of pain in the hospital. The next functional group we look at is the carbonyls. The carbonyl is a compound with carbonyl group. The functional group is C double bonded to O. Carbon double bonded to oxygen. It is found in aldehyde and ketones. How does this help or gives the nurse understanding? Carbonyl compounds are involved in many metabolic processes, such as the breakdown of glucose in cellular respiration. Ketones, in particular, are important in diabetes management. Ketones is a carbonyl. So when you study or you manage diabetic patient, you are looking out for diabetic ketoacidosis, which has to do with a carbonyl functional group. Number 4, carboxylic acid. Carboxylic acid is a compound that contains the carboxyl group. The functional group is C double O, that's carbon, double molecules of oxygen, then hydrogen. What's the nursing application? Carboxylic acids are present in amino acids and fatty acids. They are crucial in metabolic pathways like the citric acid cycle. They are also used in pharmaceutical formulation. In formulation of medication, the carboxylic acid is a consideration. As a form of summary, let's look at the functional group, their structure, their nursing example, and critical areas nurses must take note of. The first one is alcohol. The functional group is OH. We have said that in nursing, alcohols are required in ethanol hand sanitizers and methanol, which is a toxicant. Critical nursing application. Alcohol is applied in methanol poison. There are some patients that are brought to the hospital who have been toxified by alcohol. They've been poisoned with alcohol. They've taken a lot of it. Give fomepizole. This will block alcohol dehydrogenase. The antidote for alcohol is fomepizole. This will block alcohol dehydrogenase. It is also important for the nurse to monitor for blindness because alcohol poisoning or overdose will lead to blindness. The second one is amine. NH2 is their functional group. It is applied in dopamine, which is a vasopressor, and also it is applied in antihistamines, which are used for allergy reactions. Amines, such as your tertiary amines, e.g. diphenylhydramine, can cross the blood-brain barrier, leading to sedation. It is important for the nurse to assess fall risk. Whenever medications which are made of amine are administered, they could cause sedation, so there is need for the nurse to monitor for falls or advise the patient or patient relative about the risk of fall on their patient. The next one is carbonyl. Carbonyl functional group is C, double bonded to O. Nursing example: carbonyl is found in acetone in diabetic ketoacidosis breathing. Acetone has a particular smell. Whenever you are dealing with diabetic patients, if you want to know if it has gotten to that stage, you will perceive it. Okay. Carbonyl is also found in progesterone. Carbonyl in diabetic ketoacidosis indicates that there is acid in the blood. This tells us that there is need to check for Kussmaul respirations to identify at the point when there is ketoacidosis in diabetes patients. The next functional group is the carboxylic acids, COOH. Nursing example: carboxylic acid is found in aspirin. Aspirin is made up of acetylsalicylic acid, and carboxylic acid is also found in fatty acids. Carboxylic acid can lead to aspirin overdose. Carboxylic acid present in aspirin can lead to aspirin overdose. An aspirin overdose can lead to the acidification of the blood, because aspirin overdose acidifies blood. What the nurses should do is to alkalize the urine to excrete faster. So in order to alkalize the urine, sodium carbonate is given IV. This will prevent aspirin in the kidneys not to reabsorb into the body tissues, but rather to be excreted via urine. Let's look at some case study. Aspirin, which is a carboxylic acid, has a benzene ring structure. It is made up of carboxylic acid and ester. This is the component of aspirin. If there is a nursing crisis of an aspirin overdose, it will lead to the increase of carboxylic acid in the body, leading to the release of hydrogen ion, which will cause metabolic acidosis because the blood will become acidified. What should the nurse do? Administer intravenous fluid sodium bicarbonate to neutralize the acidosis and to ionize aspirin in the kidney. When aspirin is ionized, it will trap it in the urine and make it to excrete faster. Why not just give water? We don't just give water because non-ionized aspirin can reabsorb into the kidney. So here is a scenario. A patient is overdosed with diphenylhydramine, which is an amine, and aspirin, which is the carboxylic acid. Identify the functional groups involved. You should tell me the functional group involved in the comment section. Number 2, list 2 priority nursing actions based on chemistry. So the 2 nursing actions are what we'll talk about. Answer: amines can cause anticholinergic toxicity, which include dry skin, tachycardia. What the nurse should do, because there is tachycardia, we must cool the patient and then give physostigmine. Carboxylic acid can cause acidosis. There is therefore need for the nurse to alkalize the urine using sodium hydrogen bicarbonate. Memorable mnemonics: whenever a medication has to do with amine, know that wakefulness is affected, that is sedation, so monitor for falls. Whenever carboxylic acid is involved, monitor for acidosis action. Answer this question in the comment section. Ethylene is an unsaturated gas. It is used to ripen fruit. Compare ethylene versus ethane, which is saturated and inert. Why is ethylene oxide used for sterilization, but ethane is not? Let me know your answer in the comment section. As I round off, here are success circles. Special properties of carbon must be noted in this video. Definition of the functional group must be noted in this video. You must learn to practice past questions for your next examination. For those who do CBT exams, ensure you study past questions. I want to thank you for staying tuned until this time in this video. If you have not subscribed to our YouTube channel, kindly subscribe, hit the notification bell. It lets us know how you feel about our videos. Till we meet again, it is bye from me.